It is time for another edition of Wellness Wednesday with Dr. Bradley Meyer, the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody.
What a beautiful day to go out and get some vitamin D and do a little grounding.
Oh, boy, it looks to be pretty close to perfection out there today. Let's get outside and get our feet on that grass and soil and transfer some of that electron inflammation, teleport, get all that beautiful inflammation or not beautiful inflammation out of the body and beautiful balance back into the body.
Well, interestingly, here over the last couple of weeks, Robert Kennedy Jr. has joined forces with the Trump campaign, and I'm not sure he knew this was going to happen, but he's unlocked a massive platform to make America healthy again. It's something we talk about nearly every week, and I have shared with you some things. People have interviewed Dr. Casey Means. She and her brother have written a book together. It's pretty remarkable the things that Dr. Casey Means has uncovered in the medical industry. And one of the things that I think needs to be said is a lot of doctors are just following protocol. They honestly know no different. That's how they were trained. And so to look outside the box is not really high on their priority list.
Right, and it's a short visit, 7-minute visit with most of our guest patients, and so it's not set up to really do a lot of outside-the-box searches. It's look at the numbers, where do they fall in, and then apply some kind of pharmacological treatment to go forward. And a lot of times, again, doctors are incentivized through what's called quality measures. You're reimbursed if you meet certain measures. So whoever it may be that is setting the expectation or the I guess, parameters of quote-unquote wellness, they may say, well, wellness is achieved by a low cholesterol number. And how do we get to that low cholesterol number outside of lifestyle changes? Many times it's the easy button, which is something like a cholesterol medicine, and in particular a statin. And so many times that's just the easy way to get that number down. And then you meet that quality measure, and then there's that form of reimbursement. And then the patient or the person that we're sitting there with in a 7-minute visit is talking to us also about how they're wanting to meet their quality measures for their insurance company because they get a better rate if their cholesterol is below a certain number. So it's this circular and it's incentivization of, in this case, we're talking about cholesterol. In other cases, there's other ways to measure wellness. And so the quote-unquote, who determines what is well, and then how do we get there? And so a lot of our institutions train us, and they have been part of that training comes through the big pharmaceutical industry. And from there, there's, a lot of good things to help folks, but there are some times you have to always use your discernment to determine, are these the actual best definitions of wellness, and is this the best treatment for that wellness? And does the risk, is the benefit outweigh the risk in terms of treatment?
One of the things that we have come to learn over the last couple of years, many studies have come to the forefront, is statins may cause one more difficulty than what you might be telling they do for you. Number one, cholesterol is needed for your brain health.
Yes. Is it a cholesterol problem or is it a inflammation problem? And so when we come down to cardiovascular disease, a lot of times people think of blockage of those arteries, heart attack, stroke. Again, yes, statins will lower your cholesterol, But is that the big key to lower risk and to lower inflammation? Now, statins will lower inflammation a little bit, but the big thing that, like the American Heart Association, other institutions that are out there putting recommendations on cholesterol levels, those levels of what is expected to be quote-unquote normal has lowered over the years. So then, of course, many times we're increasing statin dosages for folks to reach that new goal of a lower and lower cholesterol. So we need that cholesterol to produce vitamin D, hormones, testosterone, for example. We need it for mental clarity. You got to have good cholesterol in the brain to be able to think clearly and not have problems with brain fog and memory loss. You need to have it in order to make coenzyme Q10, which is a cofactor to make ATP or energy. So when we've been on these statins all these years, what we're finding is that we're lowering that coenzyme Q10 level, which is a cofactor in making energy or ATP. So that's why a lot of folks may have some decreased energy on these statins. But an interesting study that came out, independent researchers looked at some published trials, and they found that taking a statin daily for approximately 5 years resulted in living on average about 3 to 4 more days longer. When you look at that number of potential benefit versus side effect and other downstream problems of what statins may do, this is the conversation you always want to have with your provider is, again, does the benefit outweigh the risk for me? And looking at my certain health conditions, if somebody comes in and they say, I'm losing my memory, but my cholesterol is a little bit high, is it more important to really work on that cholesterol deposition in the brain, which helps brain function, versus lowering that cholesterol for the perceived cardiovascular improvement in the risk, which that, again, is debatable in a big way with statin therapy. So, just to let you know what a big increase there's been over the years in statins, and I used to recommend that they be in water. I was like, man, this stuff is so good, should be in water, it's going to reduce all these cardiovascular events. In 2008 and 9, 12% of Americans over 40 were on them. In 2018-19, over 35% of Americans over 40 have been on them. So it's a huge industry, and it tends to be that folks come in here to the clinic in threes sometimes, and recently I've found some folks that have come in with a really, really low cholesterol level. And they started off on statins in the one case and had side effects, joint pain, muscle aches, weakness, and then they went to the injectable form to lower the cholesterol. And so certainly that's one of the things that then needs to be looked at. Okay, well, we know that your coenzyme Q10 level is probably low, your nitric oxide level is low, which is more of a factor now, we believe, in cardiovascular disease. And so we need to really think about, okay, maybe we need to discontinue some of these medications and as the initial steps in trying to improve these symptoms to these folks, whether or not it's memory or it's weakness, joint pain, musculoskeletal health, those kinds of things.
And as always, we're going to run over in time, but you start to add these things together. You do a little 2+2 combination here. You talk about statins and you talk about how some of these drugs are lowering testosterone. We know now that testosterone levels have absolutely plummeted in the USA.
Absolutely. So again, it's that downstream effect that we want to be cognizant of, and we want to look at every factor of, okay, let's not just get so plugged in on one data set, one point of cholesterol alone and say, okay, what are these things downstream? What are the things downstream that are going to be affected? And hormones, for example, testosterone, great example, because those levels continue to plummet.
Yeah. Now, here's just an amazing stat. 1 in 4 children leave elementary school on a lifelong drug. 1 in 4. And the thing that you're doing at Okoboji Wellness Clinic, and certainly some need drugs, maybe an asthma medication, something. But what you're doing is you are trying, we've talked about it so often, to peel the layer of the onion back, find the root cause, and initially you might need to Band-Aid it with a pharmaceutical. You've talked about that. But you want to get to the root cause, find out what the problem is so that you are not on a lifelong drug.
Right, and I'm look at myself as a bridge and an educator to walk alongside the individual that is wanting to have better quality of life, be more healthy, and have more energy, less pain, those kinds of things. And there's a process to safely come off of certain prescription medications, and so that's something you want to talk to your doctor about if you plan to try to do that, and that's something that we do here, that I do, that I'm going to educate and really spend the time to look at what medications you're on, what those ones that you're on potentially could be contributing to some of your symptoms and not feeling well, and so do the benefits outweigh the risks? And then we look at what do we do then to support the body in the process. So it's a bridge, it's an education bridge of realizing that we've always just been kind of, all right, go in, get on the med, take care of the problem, but what we're realizing, and a lot of conventionally trained doctors like myself around the world have come to realize that we need an integrative approach to manage people's wellness and healthcare. And that involves not just pharmaceuticals, and hopefully we don't have to rely on them in very little, but lifestyle, again, what we're eating, what supplements we're taking, what toxins we're avoiding, how do we get them out of our exposure, and how do we remove them from our system? And so that's the process, and a few little changes here and there can be big changes for the rest of your life, from quality, and such a big deal for mental health. So many folks come in here feeling hopeless, just beaten up and feeling like, all right, I've kind of been through the ringer 2 years, I'm getting no answers, and we see them and we come up with a specific game plan that with options, and we attempt to get you the results that you're looking for in a big way. And many times it's a walk over several months, and that becomes a lifetime walk of continuing to grow, learn more about ourselves, what's inflaming us, what's helping us feel better, and what tools can we use along that way, that walk, to kind of keep us in balance. And we always talk about the hyperbaric therapy, many other approaches as well, but it's such a gratifying walk to see folks get hope return and to have inflammation go down, to improve their wellness so that they can spend that. It's what's the why for everybody. We identify what that why is and then work to get you the results that you deserve.
All right, we got to run here, but if folks are looking to improve their life, not just survive the day, but live and live well, how can they get a hold of you or come see you?
I'm blessed with an amazing team here, so come on in and we give you a walk through the clinic just to see what we're all about. We're at 3305 Berklist Avenue off Highway 71 in Spirit Lake. We are at 712-339-6024. I do a Wednesday afternoon complimentary 15-minute discovery call to discuss what's going on in your life and how we may walk alongside you to help in that journey of feeling better. Again, it's such a privilege. We've got guests coming in next week to stay for 3 weeks with us from Wyoming, and we continue to do these 1 to 3 week immersions where we really concentrate a lot of these treatments together and then take the training wheels off and continue to follow you after that 1 to 3 week stay, in the case of these folks from Wyoming. So it's such a blessing to have the opportunity, and I consider it a privilege and our whole team does, where it's a mission here to get people feeling better and having that quality of life, that wellness, and return the hope and get that body doing what it naturally wants to do, which is it wants to get better. It wants to heal, and that's our goal.
All right, Dr. Meyer, always a pleasure. Have a great, great day, and we'll chat again soon.
Sounds great. Be well, everybody. Take care, Dave.
Dr. Bradley Meyer, the Okoboji Wellness Clinic. You can find them online as well, okobojiwellnessclinic.com.